Hello, welcome to BBC World News. We start with some breaking news. In the last hour, the head of the World Health Organization has declared the outbreak of monkeypox a public health emergency of international concern. At a media briefing in Geneva, the WHO Director General said 16,000 cases of the disease have been reported in more than 75 countries and 5 people have died. Dr. Tedros said monkeypox represents a high risk in Europe with a clear risk of further international spread.
We have an outbreak that has spread around the world rapidly through new modes of transmission, about which we understand too little and which meets the criteria in the international health regulations. For all of these reasons, I have decided that the global monkeypox outbreak represents a public health emergency of international concern.
Well, Dr. Tedros also acknowledged that experts had been split over whether the current outbreak constituted a global health emergency. Our correspondent Imogen Foulkes is in Geneva for us. Imogen, what about this split? Clearly, Dr. Tedros did not have full support for his decision.
No, he didn't, but the decision is actually, at the end of the day, up to him. The emergency committee is there to analyse the data and advise. And what we're hearing is that 9 of that 15-member committee said, well, maybe not quite yet, and 6 said, yes, this should be declared an emergency now. And the way Dr. Tedros explained it to us this afternoon was that he looked at the rate of spread. 3,000 recorded cases in June, more than 16,000 this month, 47 countries recorded last month, over 70 this month. That is worrying. In addition, some unknowns about why it's appearing in countries where it hasn't really appeared before. For all those reasons, and the fact that although there is an effective treatment and vaccine there in short supply, I think the WHO thought today we need to jog the attention of governments. We need to tell them, get your surveillance out there, invest more in treatments and vaccines, and let's try, if we're not too late, to get this under control.
Yes, I was about to say, so what are the implications of declaring this an emergency of international concern? It doesn't force governments to react, does it?
No, it doesn't, but they are signed up to the international health regulations. They're members of the WHO. They are supposed to pay attention. Let's make no mistake, though, this is not COVID. We are not going to have lockdowns. We are not going to have travel restrictions. It's a very different kind of illness. However, it is a very unpleasant illness. You're not likely to die, but it's very, very unpleasant. And health sectors have a responsibility to monitor, track, trace and treat. And that is what the WHO is saying today. Pay attention, test your population, make your population aware. And the other thing, which should be a worry to us all, this is actually yet another zoonotic illness, something that originated in animals and has spread to humans. We are increasingly seeing these in human health. And that, I think, again, the WHO is hoping should be a wake-up call for governments and their health services.
Thank you very much indeed. Imogen Foulkes there.